Have you ever thought about donating blood, but then you kind of stopped? Maybe because the rules seemed, well, a little complicated? If so, you're definitely not alone. So today, we're going to cut right through all that confusion and demystify what it really takes to be eligible. You're about to see how every single guideline is there for a reason, to make donating blood a super safe and incredibly powerful way to save a life.
All right, let's start with just one number, 3. What in the world could that mean when we're talking about blood donation? It sounds so small, right? But I promise you its impact is, well, it's absolutely massive.
So that number, 3, that's how many lives just one single blood donation can help save. See, when you donate, they can separate it into its core components, red cells, plasma, and platelets. And those can go to 3 different patients. So think about it. That one simple act could be helping someone in major surgery, a trauma victim, and a patient fighting cancer, all at once. It's incredible, right?
Okay, so if one donation is that important, why are there so many rules? It's a fair question. And the answer is actually pretty simple. Those guidelines, they're not there to be barriers. They're an essential two-way safety net.
This quote from the health authorities really gets to the heart of it all. The entire system is built on just 2 core principles, and they're both designed to make sure that the act of giving blood is safe and genuinely beneficial for everyone involved.
And this right here breaks down that two-way protection perfectly. On one side, it's all about protecting you, the donor. The rules are there to make sure you're healthy enough to give blood without it affecting you negatively. Then, on the other side, it's about protecting the person receiving the blood, who is often in a really vulnerable state. The screening makes sure they get blood that's safe and pure. It's a system that's totally built on mutual care. Okay, so let's get into the specifics, right? These are the fundamental checkpoints, the first things that most blood banks are going to look at. Think of them as the absolute foundation of being eligible to donate.
First up is age. Generally, the standard window for donors is between 18 and 65. Now, some places do allow 16 or 17-year-olds to donate if they have parental consent, but this core range covers most people who give blood. Next up, weight. You usually need to weigh at least 50 kilograms, which is about 110 pounds. And this isn't just some random number they picked. It's a safety measure. It makes sure your total blood volume is high enough so that giving about a pint won't leave you feeling dizzy or weak afterward. Now, this number, 12.5, might look a little technical, but it's just the minimum level you need for hemoglobin. That's the super important protein in your red blood cells that carries oxygen. They do a really quick finger prick test to check this, just to make sure the donation won't make you anemic. It's simple, it's fast, and it's all about protecting your health. And finally, we have time. After you donate whole blood, you've got to wait at least 56 days before you can do it again. And again, this isn't a random number. It's the exact amount of time your body needs to work its magic to fully regenerate all those red blood cells and get your iron stores back up to a healthy level for your next donation. Pretty cool, huh? So let's say you meet all those basic requirements. What happens when you actually show up to donate? Well, you'll go through a quick and simple little health screening. It's all confidential, totally straightforward, and it's just to make sure you're feeling well enough to give blood on that particular day. As you can see, it's really just 4 simple steps. First, there's a confidential medical history review, basically some questions about your health. Then they'll check your blood pressure, pulse, and temperature, just making sure everything's stable. And last, you'll have that same quick finger prick test for your hemoglobin. The whole thing only takes a few minutes, and it's all just to confirm that you're good to go. But what happens if they tell you that you can't donate that day? This is a really important point, so listen up. It's almost never a permanent rejection. It's called a deferral, and all that means is a temporary waiting period. It's just for everyone's safety. And the reasons you might get a deferral, they're usually super common everyday things, like if you've had the flu recently or got a new tattoo or piercing. Traveling to certain places can do it, and so can taking specific medications. Even things like recent surgery or pregnancy. Your body just needs some time to recover fully before you can safely donate. So let's be crystal clear about this. A deferral is just a temporary delay. It is not a permanent no. It's really just the system's way of saying, hey, not today, but please, please come back when the time is right. It's just another layer of that two-way safety net we talked about. So what's the big takeaway here? What should you remember from all this? It's that understanding these rules isn't about memorizing some long checklist. It's about feeling empowered. Once you know the why behind each guideline, the whole process just becomes so much clearer. Less intimidating and way more approachable. When you really get down to it, Every single rule, from your age to whether you've traveled recently, it's all there for one reason, and that's to make the entire process as safe as it can possibly be for everyone. It ensures that this incredible, life-saving resource is always there and always dependable for the people who need it most.
So we know the system is safe. We know the need is always there. And we know that your impact could be absolutely profound. So really, the only question left is the one you see right here. Now that you know the rules, are you ready to help?